Morning, everybody. How you doing? All right, so I'm gonna give you a couple videos here. One of them, the project is coming up. Okay, very simple. One case study, one patient. Okay, you're gonna have a case study. It's gonna be one patient who has multiple conditions, and these conditions are going to be conditions that are represented in each section we've done. Okay, so they're gonna have a heart condition. They're gonna have a respiratory condition. They're gonna have something related to the endocrine system. Okay, so if you're talking about congestive heart failure, you're also gonna have some pulmonary implications. If you're talking about diabetes, you're gonna have an endocrine response, but you're also going to have other things wrong with you, such as hypertension, for example, right? Now, this is where a case study comes into play. You're going to tell me about a person. You're not memorizing, you're not regurgitating the questions that I gave you in the discussion. If you remember the order in which we do this, right? It's anatomy, structure, physiology, function, and then the discussion questions, which brings it all together and tells you the application. Now I'm going to take those applications that you've done in every section. I'm going to process that in your brain, and then I want you to think of or find one. Maybe you know somebody, maybe you are just making it up. So like I gave you an example in the instructions, if you were to say grandma has congestive heart failure, she also has emphysema because she smoked for 20 years, okay, and she's obese. Okay, so what are the endocrine response, or what is the endocrine implications to obesity? And then with obesity usually comes heart disease, right? Well, why do you have heart disease? Because you're obese. Okay, well, now you have a vascular problem, and then in turn you have a heart problem, which might cause you congestive heart failure. Couple that with the pulmonary system, you have emphysema or asthma or what have you because you smoke. This is what a case study is. It's to show that you know what's normal because you've already done this. You know that the structure and the function of the endocrine, the structure and the function of the heart, the structure and the function of the vessels, the structure and the function of the pulmonary system. And now what's abnormal and how is it presented in a person? Okay, so you're never going to, very rarely do you get one issue. People who have hypertension are usually obese. People who are obese usually have diabetes. Okay, so there's an endocrine system problem, there's a metabolic condition problem, that's obesity, and then there's a cardiovascular problem. So maybe that person who has those things had a bypass, coronary artery bypass graft, CABG procedure, because they had a clogged artery in their coronary vessels. Right? Remember, coronary vessels are different, right? What does the coronary vessels do? They feed the blood to the heart. So when you have a heart attack or a myocardial infarction, it blocks the vessel in the heart. Okay. I'm going to go over another video with some details on this to give you a review. That's what the project's for. How are you going to do it? You're going to do a PowerPoint presentation. You're going to bring up your face, your screen. You're going to narrate the project. You're going to give me a discussion, talk through it, explain the case study. You're not just going to talk. You're going to have your face on it also. And then you're going to give me a case study review on these systems that are problematic with this patient. This is a case study, okay? So this is a culminating event for the four sections that you've done, and then you'll take an exam, which is a didactic approach. It's going to be a bunch of questions, a bunch of pictures, and you're going to say, oh, that picture looks like this, and because you've already looked at those pictures, and you've now said, and they might not be the exact ones on that PowerPoint, on that PDF. They might be the ones on the STEM Center website, okay? So you go to the STEM Center website, you open up these pictures, you screenshot them, you print them out, you put them on the screen, whatever you're gonna do, put them next to you, take the exam, be like, oh, that looks like that. Oh, that looks like that. And there's gonna be questions on there. Some of them may relate to those discussion questions. So it probably wouldn't hurt you to have those answers already written out in a notebook or on the side of your computer. Probably wouldn't hurt you to have your, print out your physiology experiments. Okay, so those are some of the strategies that are going to get you that grade, because remember, I can't control those grades. okay? I can only control the subjectivity of the presentation and of your homeworks, okay? So if you notice, your homeworks are pretty cut and dry, okay? At this point, I'm really going to evaluate now whether or not you understand everything you've done thus far and be able to put it together and communicate it to me. That's what you're trying to do, okay? So it's 50 points, okay? You get evaluated on, as outlined in the instructions, how you give the presentation. Are you speaking clear and concisely? Are you talking like I'm talking right here? Is your information correct, or are you making stuff up out of nowhere and it's wrong? That's not correct, so you get points off, right? How well you communicate it. Does it all flow? Okay. What I don't want to see is, I don't want you to be like, here's the autonomic nervous system, blah 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 blah. Stop. Here's the heart, blah 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 blah. Stop. And such. No, I want you to communicate it to me in an organized fashion where it flows together. Well, X, Y, and Z are affected during this patient. She presents with congestive heart failure, obesity, and diabetes. So we're going to be looking at an endocrine response to this disease pattern or this pathology. We're going to be looking at a cardiovascular issue and a pulmonary. All right, and so if you recall the coronary system, the heart, it's still, she's had a blockage in the left anterior descending, what is that called? Why is that important? She had a myocardial infarction. Whatever it is you're going to explain, you're going to talk to me in a conversational way, using your PowerPoint as a guide. Some of you may or may not have done this before. This is how presentations are given. They're not just supposed to be a series of, paragraphs on a PowerPoint slide and you just sit there and read it. That's not how it works, okay? Imagine you're giving me this presentation in class and we're talking about it, okay? Or you're talking about it to your fellow students. Remembering that this is not high school, and this is not like, shooting the shit in a bar, okay? You're giving a clinical case study in a college environment, okay? So assume that I know what you're talking about. Assume that your fellow students know what you're talking about, using proper terminology, using anatomical language, all right, as best as possible. So if you're going to use directional terms, it's lateral medial, superior inferior, it's deep, it's superficial, where is the structure located, what is it adjacent to, what is its implications, how does it play a role in this pathological sequence, okay? All right, so easy day. If you have any questions, please don't hesitate to ask, and I'm going to give you another video here in a second that outlines some of the structures a little bit better. All right, have a good one.